Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, December 17th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, we'll be releasing a written briefing, a written presentation with an update on COVID-19 cases and other relevant information with respect to the pandemic in BC. That should be around 3 o'clock. On Monday, Dr. Henry and I will be here in person for a briefing. That's Monday, December the 21st. On December the 22nd, there'll be again a written update on December 22nd, Tuesday. And then on Wednesday, December 23rd, there'll be a further in-person briefing, and that in-person briefing will include a presentation by Dr. Henry on modeling and other relevant information about COVID-19, about the state of the pandemic in BC, and information that will be of interest. And a presentation will be as part of that briefing. And so with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today we are reporting on 673 new cases of COVID-19 in BC, including 6 epidemiologically linked cases, bringing our total number of people diagnosed with COVID-19 in BC to 44,776. Of the new cases, 145 people were in Vancouver Coastal Health Region, 403 people were in the Fraser Health Region, 4 were in Vancouver Island Health Region, 66 people were in the Interior Health Region, and 47 in the Northern Health Region. In addition, we had 8 new cases in people who normally reside outside of Canada. We now have just over 10,009 active cases, of whom 358 people are in hospital, 93 of whom are in critical care or ICU. We also have 10,388 people under active public health monitoring because of exposures to COVID-19, and 32,963 who are recovered. Sadly, again today, we've had 21 new deaths from COVID-19. The majority of them, again, are seniors and elders in long-term care, bringing the total number of people who've died in British Columbia to 713. My condolences go to the families, to your care providers, and to communities. We feel your loss, particularly at this time of year and this time in our pandemic. We have no new healthcare outbreaks to report, leaving us with 55 active outbreaks in long-term care and assisted living, and 6 in acute care units. That includes 1,374 residents and 735 staff with COVID-19 right now. There have been 2 new outbreaks in the community, one of them at Wingtat Game Bird Packers, which is a poultry processing plant in the Fraser Health Region, and the other, the diversified transportation employees connected to LNG Canada. As Minister Dix mentioned, next week we'll be providing a data update to show some of the progress over the last month and where we are in the pandemic right now. On a positive note, of course, we know that vaccine has arrived here in British Columbia, and in the last day, up until yesterday, 1,215 healthcare workers have received the COVID-19 vaccine, and that is a great testament to the work of the public health clinics and to healthcare workers who have stepped up to do their best. Starting next week, we will be receiving weekly vaccine deliveries, and it is a moving target, and we are receiving updates about amount of vaccine and when it will be received, sometimes multiple times a day. But we do expect and are planning for immunization clinics in every health region across the province starting early next week. And I know many people are eagerly awaiting this. As you can imagine, this is a national effort, and we get deliveries and processes set up, and things are rapidly changing, and timings will be provided as soon as they are confirmed. And I've received a number of questions about the vaccine, but one of them that I've received from a lot of people is why the vaccine is not recommended for people who are immunocompromised and what exactly that means. For some people with an underlying health condition who are undergoing certain treatments or on certain medications, it lowers their ability for their body to respond to viruses, and we know that that makes people more at risk of having severe illness with COVID. But it also means that they may not respond as well to certain vaccines as well. This would apply to people who've had an organ transplant, for example, have chronic liver or kidney disease, someone receiving chemotherapy, or certain immunosuppressive therapies. If you're wondering if this applies to you, because it's not all kinds of immune conditions, the best thing to do is to consult with your healthcare provider. The reason that this vaccine is not yet recommended for people who are immune compromised is because the clinical trials expressly excluded people with those conditions and focused on primarily healthy populations of people of different ages. So there were very few people who did have immune compromising conditions who were in the trials. So what that tells us is that right now we just don't know whether these vaccines will work and whether they're safe or whether they may have some effects on the immune system. Having said that, this is a recommendation from our National Advisory Committee on Immunization, who reviews all of the data that we have on safety and efficacy, so how the vaccine works. But it also, part of that recommendation is to make that decision with your care provider on a case-by-case basis, whether the risk of being infected with COVID outweighs the risk of receiving the vaccine. So that is something that will have to be done on a one-on-one basis for people who have immune compromising condition as we learn more about this vaccine. It is also, of course, important to understand that while we continue to respond to the COVID-19 pandemic, if you need medical care, it is available and it is safe in hospitals, in healthcare facilities, and in primary care clinics across the province. You do not need to delay appointments, and if there's a reason to call 911 and you need emergency care, don't hesitate. It is safe to do so. As we have evolved our approach with COVID-19 and learn more about the virus and how it is affecting people, and we learn more about the tests and how they work, we have recently updated our approach to testing to ensure that those people who most need to get a test right away realize that and do that. And we also recognize that for some people, it might be okay to stay away from others and to wait and see if you need a test. Here in BC, the majority of new cases continue to be directly connected to somebody we know has a confirmed case or a cluster or an outbreak. So if you have been in contact with anybody, or you've been part of a cluster, or there's something going on at your workplace or in your social group, and you have any symptoms at all, you should arrange to get tested immediately. What we want to do is focus where people know that they need to get tested immediately. If you've not been around anybody that has COVID, and we're updating the guidance to make it clearer for people. It's not that you can't get a test, but there are certain people that we want to get a test right away. We know that many of the symptoms of COVID-19 are similar to other respiratory illnesses that we see this time of year, influenza for one, but other colds and respiratory infections. There are 4 symptoms, though, that have shown, when we look at the data of people who've been tested, that are very much associated with COVID. And these include having fever, chills, a cough, loss of sense of smell or taste, and difficulty breathing. If you have any of these symptoms, if you're feeling short of breath, if you've lost your sense of smell, then you need to get a COVID test right away. That's a priority. Even if you've not been around anybody with COVID, you need to get tested right away. There are other symptoms, though, that also happen with COVID, but on their own, they don't necessarily mean you have the virus. those are things that are fairly common this time of year, like sore throat, loss of appetite, fatigue, headache, body aches, nausea, and diarrhea. So those, in that case, if you have 2 or more of these symptoms, you can wait and see, but you can also go for a test. And if you feel the same or worse after 24 hours, then you can get tested. So it really is to make sure that if you have any of those worrisome symptoms, that you do go for testing right away. And if you've had any contact with somebody who has COVID and you have any symptom at all, again, you must go for testing right away. If you're uncertain, you can call your health provider or 811. And as always, if public health is doing investigations, there are many times that we tell people whether they have any symptoms at all, they're asymptomatic, that they still need to have a test. And we do that in workplaces, we do that in long-term care, and when we're investigating outbreaks. I've spoken many times about BC's COVID-19 response, whether that's the orders and guidance, the changes in long-term care, and now, of course, the vaccine. If there's one thing that we have learned, it's that to keep our wall strong, we need a team effort. We are a team made up of frontline healthcare workers, other frontline workers, our contact tracers, and, as I had the pleasure of seeing earlier this week, our immunization teams now, who are providing COVID-19 vaccine. It's also the hundreds and thousands of people across BC who are doing your part every day, at work, at school, and at home. Together, we are using our layers of protection and following all of the public health orders, keeping our groups small. And this is more important than ever, especially as we go into this holiday season. Together, we are making a difference. Many people have already decided to make their holiday celebrations safe celebrations. I've also made that commitment to celebrate safely, to stay small, to keep my community and the people that I care about most safe during this holiday. I ask you, please, to do the same. Make the commitment today to have a safe holiday celebration. We may be days away from the solstice, the darkest and the longest night of the year, but without a doubt, we have light ahead, and we can't let all that sacrifice that we have done together in this past year be all for naught. What you do makes a difference and is making a difference today. The efforts you make mean that we will all be safer as a result, and we will get through this pandemic. So let's together make this holiday season a safe season for all of us, and continue to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry, and I want to start by sending my condolences to the families, the friends, the caregivers, the communities of the 21 people who passed away in the last day from COVID-19 in British Columbia, 10 of which were of whom were in the Fraser Health Authority, lived there, 10 in Vancouver Coastal, 1 on Vancouver Island. As Dr. Henry has said, I think as we can all reflect, this is not a good time of year. If any time of year is any good, to lose a loved one. It's certainly not a good time during the pandemic when we have great challenges coming together, meeting together, to mourn together. And so all I can say is to express my sense of genuine solidarity with the grief people must feel right now, and ask everyone to reach out virtually to everyone they love in their lives today, and acknowledge that love and that need to be together in the ways that we can be together, and think of the people who were lost today from COVID-19. I wanted to note what an extraordinary time it continues to be for public health, and to thank people, members of the Hospital Employees Union, the BCGU, of the Health Sciences Association, the BCNU, the Doctors of BC, QP, the ambulance paramedics of BC, QP Local 873, who are doing, in these times, extraordinary work. We had 4,992 emergency room visits yesterday. That's less than normal, it should be said, especially for this time of year, but nonetheless, a significant challenge for people in the hospital during a pandemic. We had our acute care facilities, their occupancy, when you count surge beds, is 69.9% of overall beds and 53.6% of ICU beds. But in terms of our regular bed capacity, that occupancy is 88.8% in regular beds and 78.2% in ICU beds. Obviously, in some regions and in some places, it's more of a challenge, and I want to shout out to the extraordinary work done by healthcare workers at the University Hospital of Northern British Columbia at this time. We have 10,009 active cases of COVID-19 in BC, 10,388 people under public health surveillance, and as Dr. Henry has noted, 1,215 people just getting started who have been received their vaccination, their vaccine provided by Pfizer against COVID-19. Wanted to just bring you up to date on a couple of things that I promised to update you on. The first is that there will be new holiday guidelines posted with respect to holiday celebration and decorations in long-term care and assisted living. Essentially, to summarize, and people will be able to see those on the Ministry of Health website, that holiday cheer is appreciated and encouraged, and all celebrations in long-term care and assisted living, of course, should be undertaken in a manner to ensure residents are able to celebrate as safely as possible. So facilities will be encouraged to decorate facilities as per normal practice while keeping in mind the guidance provided in the policy. There was some discussion of that last weekend, and we wanted to clarify that and have a common policy across health authorities, and that's what this, I believe, achieves. In addition, I wanted to report that to date, 1,235 people have been hired as part of our contact tracing initiative. You'll recall that it started with 500 in the initial announcement, was moved up to 608, and now our target was to hire 1,224 positions. 100% of this new target is now complete. In addition, we've had additional supports from Statistics Canada. We're actively working with the Red Cross and others to help run our logistics and running the operational center of the regional contact tracing hub at the Vancouver Trade and Convention Center. And that 76 community health representative positions to support culturally safe contact tracing efforts within First Nations communities are to be hired with money provided or funding provided by the Ministry of Health, by the First Nations Health Authority. In addition, we are continuing to build up our capacity in terms of contact tracing. 385 candidates are currently in the interview stage. 121 candidates are in the offer stage. And just to note by health authorities to show that it's everywhere in BC, that the teams have been hired. This is in addition to the 500 to 600 people that were involved in contact tracing before August. 280 have been hired in Vancouver Coastal Health, 579 in Fraser Health, 71 in Island Health, 63 in Interior Health, 42 in Northern Health, and 200 at the PHSA, which includes, of course, the BC Centre for Disease Control. With respect to surgeries this week, as you know, we have our surgeons, our nurses, our health sciences professionals, our healthcare workers are doing and continue to do an extraordinary job. Since we made the surgical renewal commitment and relaunched non-urgent scheduled surgeries, or elective surgeries they're sometimes called, on May 18th, 52,997 have been completed in Fraser Health, 35,629 in Interior Health, 11,413 in Northern Health, 46,076 in Vancouver Coastal Health, 40,443 in Vancouver Island Health, and 7,856 in the Provincial Health Services Authority. Last week, health authorities reported 6,859 surgeries completed from November 30th to December 6th. Health authorities have now verified their data, and the total number of surgeries completed was, in fact, 7,335, again, significantly higher than the equivalent period last year. This week, we're reporting that we've completed, again, in the initial report, 6,747 surgeries, and we will be updating everyone in BC with our monthly reports that are led and put together by a team led by former Fraser Health CEO Michael Marchbank will be providing that information and update on that next week. I wanted to note that with respect to the Health Human Resources to support senior services in BC, that approximately now 1,151 FTEs have been hired to support visitation. That's up 297 since our last report, I believe. And we've also have a very significant number of people, 5,085 participants have participated in our Health Career Access Program participant pool now, which is up considerably after clearing their preliminary checks. And a further 4,790 people have expressed interest. So that is part of our initiatives to hire 7,000 individuals into the health service sector over 3 initiatives to support seniors' care. As you know, in the last few days, the conversations about COVID-19 have changed. There's been, of course, some discussion of vaccine. Well, of course, we're all reflecting on the cost, the continued cost to our communities and to all of us of the pandemic. And I think I wanted to say this. You know, we often, we are at a time of year where we want to come together, and of course we can't this year. And there's always a desire to talk about where the line is. And I think we've been pretty clear that when you're in doubt, it's time to rule it out. That as our attention focuses on the holidays, we've got to continue to use the skills we've learned to stop the spread of COVID-19, continue to follow the guidance of Dr. Henry and public health across British Columbia, continue to abide by orders that have the effect of saving lives. It is especially important now. In some ways, this period is our most challenging period because as we start with the joy and real celebration of having vaccine, and now more than 1,200 people having received it in BC and the remainder of our vaccine to be used this week, we have to dig deeper, it seems to me, dig deeper to act to stop the spread of COVID-19. Aujourd'hui, nous annonçons 673 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 44 776 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 21 nouveaux décès liés au COVID-19 pour un total de 713 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 358 personnes sont actuellement hospitalisées, dont 93 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. Please unmute your phones. You're not audible until your name is called. First question today is from Richard Zussman, Global News.
Dr. Henry, I'm just curious about that number of cases linked not to one of the health authorities, up to 8. I can't remember a time where that number has been that high. Are we worried that this is people traveling from outside the province coming to British Columbia potentially for the holidays and with them either bringing with them COVID or spreading COVID?
Yeah, no, not in, well, we're always worried about that, of course, but this is really people who are here for work, so temporary farm workers working in some of the situations I know some of them in Big White, for example, so some of the outbreaks, people who normally don't reside in Canada.
Do you have a follow-up, Richard?
Thank you for the clarification. I'd like to ask about the decision from the Privacy Commissioner today around First Nations data. There are still significant concerns from First Nations community about not having specific COVID data for their communities. They need it to make informed decisions. Why does the government continue to not provide the specific data to First Nations communities?
Yeah, so I think we're looking at the Office of the Privacy Commissioner's decision in some detail, and I'm very appreciative of the work he did to really get at the issues around this. And we are continuing to work, particularly with the coastal First Nations. We've had a number of really actually successful open meetings about the information they need, the information that we can provide to support it, and we are negotiating an agreement on that. I absolutely understand and commit to providing as much information as I can to support First Nations and all First Nations leaders. And I've had the privilege of meeting with the First Nations Leadership Council again this week for a couple of hours to talk about the importance of vaccines in their communities as well. So we are committed to make sure we have the information and the arrangements and the agreements that they as leaders and governments in their own nations need to make the decisions they need to make. And just to say that I also have a responsibility to keep certain information confidential on people's personal health information, and it's a balancing of those two things. And we do have an ongoing agreement very early on in this. I compelled the linking of data with the First Nations client file, and that information is provided on a daily basis to the First Nations Health Authority so that they do, and we all do, know the information about First Nations peoples and how they are being affected by this pandemic. And that is very important.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry, and I probably won't get a chance to tell you this ahead of time, but happy Christmas heading into the holidays. I'm going to be off for a few days in the next couple of weeks, but wanted to ask you how concerned you are about an outbreak right now at Vancouver's Little Mountain Place nursing home, where at least 17 people have died, and almost everyone there has tested positive for COVID, considering that there's 117 beds there and 119 people now that we've been confirmed to have the virus.
Yeah, there are a couple, and we've mentioned this, there are several long-term care outbreaks, both in Fraser Health and in Vancouver Coastal, and one in the interior, where we've had larger numbers of people, and it's been such a challenge to try and stop the transmission. The numbers of cases, of course, include both patients and residents, and staff at that facility, but it is differentially the residents who have the more severe illness who are dying from COVID. So I am obviously very concerned. We've been talking, we're doing an intense blitz on all long-term care homes to try and be sure that we are stepping up all of the measures to try and prevent transmission. What we are learning is that this virus spreads so easily this time of year, and that when it gets into a care home, an assisted living facility, some of our acute care facilities, it can spread very rapidly, and it's very much a challenge once it starts spreading to gain control again. So I know they're working very hard to try and this also speaks to why it is a focus for us to get as many people who work in long-term care immunized as quickly as possible, and as soon as we are able, we will be taking vaccine to residents in care homes, and I'm hopeful that will happen in the coming weeks as well.
Do you have a follow-up, Marcella?
Having said that, what more can be done to test people so that we're not seeing these kinds of outbreaks taking over an entire facility like this one has?
Yeah, testing is part of it. The screening, the physical barriers, the cleaning, the keeping people apart, trying to reduce the number of people. These are all things that we are working on. There is screening being done at facilities. There's testing being done as soon as anybody is identified. All of the staff and residents are tested on a repeat basis. That's part of the protocol. It is very, very challenging, these situations.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. The BC Civil Liberties Association has sent you a letter asking why religious services are banned while restaurants and retail remain open. They say the right to practice religion is protected by the Charter of Rights and Freedoms, and they're urging you to change your order banning in-person church services. So why can't you make an exception for small, masked, physically distanced church services when people can still go to a restaurant with their family?
Yeah, I think we all know that church services are fundamentally different than a retail transaction or a transaction with their family in a small group in a restaurant where you're walled off from others. There's a fundamental difference in how we come together in worship, places of worship. And what we have seen is this virus doesn't recognize that it is a church or a synagogue or a temple. And when people are coming together, and we saw this, we saw that even though we were following all of the safety protocols we had in place, and as you recall, we've been very consistent through this at 50 people keeping distances, that even with those safety measures in place, it was being transmitted in some of those settings. And so that is why those settings are included in those that we know are high risk right now. And this has nothing to do about taking away people's rights to religious freedom at all. There are many, many ways, and many of the leaders in the religious communities across the faith and spiritual communities across this province have let us know that they are practicing their faith despite having to protect each other by staying apart right now. So this isn't about whether a service is essential. Absolutely, religious services, faith services, spiritual services are essential for people. I recognize that. We recognize that. This virus, on the other hand, recognizes situations where we come together, and these situations are risky right now.
Follow up, Shannon?
Yeah, a group of families say the charter rights of seniors are being violated by visitor restrictions in care homes that, even though an essential visitor is allowed, many are being denied access with a lack of consistency between care home operators, and there's no mechanism for appeal. Dr. Henry, why is this being allowed, and what, if anything, can you do to address the discrepancy?
Yeah, we've been quite clear on the what an essential visitor is, and recognize the importance of essential visitors, and have been working to ensure that those guidance are applied appropriately and consistently. And there is indeed an appeal mechanism, and there's several layers of that, so people can appeal right away to the manager of the facility, but there's also to the patient safety quality office, etc. So this is an ongoing challenge for sure, and right now it is really important that we pay attention to what we're doing, how we're interacting with people in long-term care. And we have seen how devastating these outbreaks can be, and we are focusing our attention on doing what we can to protect people in long-term care, residents and workers, by focusing our vaccine efforts right now. But it's going to be some time until we can fill that gap and keep people protected. I don't know if you want to talk to that.
Just say with respect to churches that we had part of our continuing consultation today with faith communities about the impact of COVID-19, seeking their views on the situation, seeking their counsel and their advice, and that process is being led by Dr. Robert Dahm is off to a good start, and we're so appreciative of all the faith communities that took part, the 200 who took part in the call with Dr. Henry, myself, and the Premier on Monday, and the many who took part today and will in the days to come. I just say very clearly that there's a list of events which are most secular and some not secular or religious events that are not allowed right now. Gatherings are a significant problem. Dr. Henry has made that very clear. COVID-19 doesn't argue these questions. COVID-19 seeks new hosts, and right now, in November and December in the world, COVID-19 is on the march, and so we have to take steps right now to protect one another and protect our most vulnerable. And that's true in long-term care as well. With respect to visitation, that it has been extraordinarily difficult for everybody involved, family members of residents in long-term care. And there are ways to appeal those circumstances, but I would say this: our priority, our focus right now with our vaccine policy, but everything else, is to do everything we can to make things safe and safer in long-term care and in assisted living, and for seniors in our community as well. And so, and part of the goal of that is not just to keep people safe or to immunize those communities and care workers so that our long-term care numbers we can see go down, but also to reestablish the kind of life that we would want to have for our loved ones in long-term care, to reestablish social activities in those communities who have been without them more than anyone else over time. And so when we are debating specific rules and we're saying, well, can we just be on this side of the rule or not that side of the rule at this crucial time when we're working to keep those long-term care homes safe, I ask people, when in doubt, rule it out. And to not think that we can litigate, negotiate, argue with a COVID-19 virus that doesn't want to litigate, it doesn't want to argue, it just wants to transmit.
Next question is from Gordon Hoekstra, Vancouver Sun.
Thanks for taking my question. Just a little bit further question on the possibility of getting a vaccine into long-term care homes and to the residents. Is there any sense about the timing of that at this point? You say a couple of weeks. Can you be more specific? And is it likely there any chance of it being the Pfizer vaccine, or will it more likely have to wait until Moderna, given its sort of imminent approval?
Yes, so that's the question. We are watching very carefully. So Pfizer has required, as I've mentioned earlier, us to administer the vaccine at the point of arrival of the shippers, the shipping containers that have the dry ice and everything, and that we had to have an ultra-low temperature freezer at that site. And this was to proof the system, to make sure that the vaccine could be transported safely and to monitor the effectiveness of the vaccine, the stability of the vaccine through all of the transportation. So we are hopeful. We're here that that it may be as early as tomorrow that we're going to get advice from Pfizer about how it's worked. We have different checks and balances and data that we've been sending back to them all along the way, and it's been worked out together across the country. So tomorrow we hope to hear some news. That would be the earliest, and our plan is, as soon as we are able to, that we will be targeting immunization to long-term care residents and workers in the care home. That's the way we do it for influenza, so that's ways that we're quite used to providing vaccines to residents as well as to workers. So we're hopeful that that might happen as early as next week if things work out, that things worked with the supply chain this week. And the second vaccine, as you say, the Moderna vaccine, again, we've heard finally that we are going to be getting some doses in December, assuming it gets approval from Health Canada for safety and for efficacy, so that it works. And just heard not too long ago that the FDA in the US has approved Moderna vaccine, and I know Health Canada is going through the papers and the data right now, and have been for some time, so we're hoping that we'll hear from that very soon as well. So whichever of those happens first, we'll be looking at targeting those people most at risk and moving into long-term care residents as soon as we can. And that is going to be a game changer for us. If we get through this period, we can protect residents in long-term care, and we can start allowing people to safely come back into those communities again and be with their loved ones.
Follow up, Gordon?
I do. I already had some questions about, people would be, maybe not on the immediate priority list, but sort of a little bit down the list, but still in there, like, folks that are over 80, and just, asking the question, once vaccine's available, how do they find out or know, to get the vaccine? Is that something that will be communicated, by, you have to make an appointment? Will they be notified? Would there be clinics set up that they would, something like you'd go through one of the drive-through things where you get tested, Do we have any idea about that yet?
Yes, so we are looking at all of those ideas, and yes, as we've said, we've had a very small amount of vaccine this week, 3,900 doses. We're figuring out how to use it, how to make sure that we use it properly and that it's safe to use and that the clinics know how to run, and we're going to be expanding that across the province. So we only just earlier this week received confirmation of the doses that we'll be receiving next week and the week of the 28th of December. And today we got notification that we will be receiving doses the first week of January. So that allows us to understand the numbers of people that we can immunize in these weeks. Having said that, right now, the maximum number of doses that Canada expects to receive in the first quarter of 2021, and what we're receiving here in December comes from that allotment. So we the contract is to receive enough to immunize 3.8 million people across the country. And here in BC, that works out to about 380,000 people in BC. So when we do the math of how many people are in long-term care, how many residents, how many people in assisted living, so the other higher risk environments that we're starting with first, the healthcare workers in our acute care system that are key for the COVID response, and in some of the response, like the public health teams that go out to different acute care facilities, some of our more at-risk populations and people over age 80 in the community. We're looking at phasing that in over the next few months between now and March. And yes, we will have a system for making sure that people have equal or equitable access to vaccine. We're still working through those details as we get confirmation of when we might receive more vaccine. So please be patient. We will be working it through. We will make it very clear when we know how much vaccine we have, how it's going to be delivered, where it's going to be delivered to, and people will get a notification of how they can get their vaccine.
We have time for one more question. For everyone listening this afternoon, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Tina Lovegreen, CBC.
Thank you so much for taking my question. Dr. Henry, you mentioned earlier your concerns about the outbreak at the Little Mountain Care Home. You know, we've heard from family members of loved ones there who say there is a lack of transparency from both Vancouver Coastal Health and Little Mountain in particular. Do facilities and health authorities need to be more forthcoming with family members about conditions inside facilities?
Yeah, I know they have their processes for doing that, and that they do provide information to families on a routine basis. I can't speak to Little Family directly. I'm not aware of exactly what is being passed on to families in that facility, but I'm upset to hear that people are feeling that they're not getting the information they need, and we'll certainly follow up on that.
Do you have a follow-up, Tina?
Yes, thank you very much. Just to follow up, with hospital bed capacity nearing 90% in BC, I was wondering how close are we to having to activate the field hospital that was set up at the Vancouver Convention Centre back in the spring? And if we could also please get an answer in French.
Yeah, as you know, when we moved into the fall, we had our scaled up plan for how the acute care system would respond to the second wave of the pandemic, and it did include, of course, still the potential for the field hospital, and it is ready to go at I think we're at 48 hours notice, and we are maintaining that resource. We're not at the place where we need to do that, and we are monitoring around the province, making sure that backup where it's needed. And as we've talked about, it's been a challenge in the north in particular, where there's been a number of hospitalizations, and part of the plan to ensure that we can maintain services as they're needed across the province. Several people were transferred both to Vancouver and here to Vancouver Island. So we are managing, we're coping, but it reminds us again how important it is for all of us to do our piece right now, because we are bumping up against that stretch in our health system, in our public health system. We've flattened our line, but we have not yet come down to the level that we need to. There's still too much transmission in our community, and that reflects in outbreaks in our long-term care. It reflects in workplaces. It reflects in cases that we see in schools. So now is the time that we have vaccine. We have a way that we can see light at the end of this tunnel, particularly to protect those who are most at risk and to take that pressure off our healthcare system. But it's going to take us weeks to get that vaccine to where it needs to go so that we can breathe a little easier. And right now, I need everybody to keep your gatherings small. Stick with your household. Celebrate and be close to those that you love, that you care about in a virtual way that keeps everybody safe so that they're here to celebrate with you on Family Day, on Easter, next Christmas.
And just to put that in context, Tina, last year at this time, the hospital capacity in acute care was just over 104% of capacity, so we were adding new beds at that time. So apples to apples, our base is about 88.8%, which is well below where it was this time last year. Obviously, the circumstances are different. And we also added surge beds, so that means we're right now at 69.9% of capacity with the beds we've added in our existing healthcare facilities to deal with the situation. And in addition to that, we have the capacity, if we need to, and as we showed in March, to lessen other activity in the healthcare system. For example, last week we did, for this time of year, I should say the last weekend, the week ending December the 6th, we did, I think, 7,300 surgeries, which would be the most we've ever done in that period at any time. So obviously, if we needed to deal, especially for surgeries that require ICU or ICU backup, we would be able to limit those numbers if necessary. So we have a lot of flexibility in managing the system right now, and our folks are doing a tremendous job. But there's also no question that when you have 40 inpatients, 40 patients with COVID-19 in a hospital such as the University Hospital in Northern BC, it puts stress on the hospital, and we have to mitigate that by finding and opening new wards and dealing with that situation. So, and the final situation, of course, is simply the challenge, and the real challenge after basically a year of this, to our doctors, to our nurses, to our healthcare workers, to our health sciences professionals who are under tremendous stress. So the issue really isn't the bed capacity. We're fine on bed capacity, as you can see by the numbers. The challenge is the challenge to the people working in acute care, and it's real. Je dirais qu'en général, on est occupé dans les hôpitaux en Colombie-Britannique à 69,9% quand on compte tous les lits disponibles actuellement. Les lits de base, le taux c'est de 88,8%, c'est-à-dire qu'on est prêt pour la situation. Il n'y a pas besoin actuellement pour l'hôpital provisoire au Vancouver Trade and Convention Center. Ce n'est pas nécessaire maintenant, mais on garde cette ressource au cas où il est nécessaire d'utiliser. Donc, c'est pour cette raison qu'on a décidé de protéger cette ressource malgré le fait qu'on est actuellement en bonne position vis-à-vis des lits. Cela étant, il est bien entendu très difficile pour ceux qui travaillent dans les hôpitaux actuellement, avec le niveau, le taux des cas de COVID-19 dans les hôpitaux. Et donc, on est sensible à la fois à la nécessité d'avoir des personnes, surtout en soins intensifs, mais aussi sur l'effet de COVID-19 après quand même 10 mois sur la capacité de vivre et de travailler de ceux qui travaillent, nos infirmières, nos médecins, nos travailleurs dans les hôpitaux. Donc, on est avec eux et c'est évidemment un défi, mais cela étant, maintenant, on tient dans les hôpitaux. Merci beaucoup. Thank you very much. We'll see you on Monday.